Okay. Okay, so it's recording, yeah. Yeah. Do you want me to put it here? I feel yeah, Niehaus, so yeah, so. Hello, everybody. Oh. There's a couple QRs on this screen if you haven't gotten them already. Just a reminder, dues are due October 9th. The pink one is the email list. And then for the dues, you want to make sure you pay them as soon as possible because it gets you access to the group me where we'll send out large animal rounds. That's for dues paying members only. So get that in as soon as possible so you can sign up for those rounds. And yeah, there's a QR to our website as well. We've gotten a couple of group me questions about information on our website. That'll be where you can see your points. It'll be where you can see election information if you're already thinking about that stuff. So a lot of information on there. Our constitution's on there, and then all the exec board emails are on there too, because sometimes group me is hard to kind of check often. But I'll give you guys a minute to scan that. Other announcements, we have our first community engagement meeting September 30th. Isabel, if you can talk a little bit about that.
Hi guys, I am working in the chair. So every single month we do have community engagement meetings, and they kind of all have different focus each month. For the upcoming meeting on September 30th, it's going to be in a Marston classroom, and look out you could be not limiting the specific classroom reviews. But it's just the PVMA study table, midterms will come. A lot of people are kind of that big. They're a little overwhelmed with myself completed. And so it's just a time for us to kind of get together. We want to talk about something, share, anything that's been going on. And it's just an hour to get into it. Positive economy to that energy way. So if you are thinking about applying to the board at some point, you have to start wrapping up those things. And it's really easy to me to come to in order to that. So I hope to see you guys there. Thank you.
And then the Seaface Career Fair is October 2nd, 1 to 5 in the Fawcett Center. There are buses that go out there because it's a little far out. And then also the Fall Flannel Fest, October 9th, 5:30 to 7:30. It's super fun. If you're involved in some animal science orgs, they'll be doing a canned food drive. So start thinking about that as well. And then our club shout out this week is zoology. The purpose of this club is to support students interested in zoology and other disciplines in the biological sciences. They're super nice. Everybody on the exec board is really open to meeting members of our club as well and collaborating. So that's their email and their Instagram too, if that's something you're interested in. And then here's your mental health reminder. Remember, if you have anything going on or just need someone to talk to, you can always reach out to our mental health chair, Addison. It's her phone number and her email as well. She's great. All right, and then today for our meeting, we'll have Dr. Niehaus speaking about large animal medicine. If you don't know him, he's our club advisor and he does a lot for us. So please give him your best attention. Thank you.
Well, thank you, everybody. It's so great to see all of you here. I am just really impressed with how many of you guys came out tonight. And I see that my drive that's supposed to come up when I log on did not come up. So that's a fun start to this presentation. Let me try something real quick. I'm going to restart. And I'm hoping, oh no, well, okay, let's see. Hopefully, while that comes up, I'll just kind of introduce myself a little bit. So, I they only go to farms. And certainly that is a huge part of a lot of large animal veterinary medicine is doing ambulatory work, getting out and going out to farms. I actually have the job of actually staying in the clinic. And so I actually have a climate controlled environment that I work in. If being out in the cold and the elements is something that that tends to scare anybody. So that is maybe a little unique facet of my job. Hopefully, as I sign back in here, I have a shared drive that comes up. Oh yeah, nice. And a little bit more background about me. I grew up in West Virginia, rural West Virginia, northern Panhandle. Everybody, usually we have one or two people, but anyway, so I am just on the other side of the Ohio River. I grew up flying about so what interested in veterinary medicine was. And I figured that I would go back home when I graduated. I was playing in my home. I was going to spend 4 years at vet school. And I was going to go back home and probably do some. You guys are okay if I don't use the microphone, right? All right. Story. I was giving a lecture at a at an ACBS, at a surgery conference here, I don't know, about 10 years ago. And with these big conferences, there's usually like mall lectures and stuff happening. And they usually have like small lectures that are attended by actually like what this is now. And apparently they're minus faculty. They use, you know. I'm like, okay, it's a small little room, but it's okay. And they have these speakers in here, which was about like oversized for the room. And they had this mic. And I'm not sure why, this wasn't a long ago. Wireless technology was doing pretty good. But they had a wired mic. And I am not really good at standing in one location for an entire presentation, but I was tethered with this wire, right? And so I've been trying to walk around, but being mindful of how much wire to go. And apparently I lost track and I stepped outside of my little boundary and the mic came on. And you would think that the sound would just like be talking to the left, be quiet. But instead, it was associated with a sound that could be best be described as a small explosion in this room that was small already, with really good acoustics and huge speakers. And I completely, if anybody who's falling asleep, I slow, including myself. And so it's safer if I don't now things attached to me. Anyway, where was it? So I grew up in West Virginia on a beef farm over in the very far field. We have hills there too, by the way. So as compared to Central Ohio, there's some beef, there's some black dot dots on the hillside over there. That is my so I wanted to go to large animal medicine when I went to vet school. And my plan was to go back home. And I spent 4 years in vet school. And even well into my senior year, the plan was to go back home and probably continue to help my dad on the farm and have this vet practice. And then I had an opportunity that opened up here at the college, my very late, my senior year, which was an internship. And I never thought that I would stay a year. In fact, my senior year, they said he wasn't need this. And then you know, I want to say honest, and I'm like, you know, I grew up in this environment in big city life, and I'm moving back home. And I had an internship opportunity that opened up, and they said, well, just one year thing, you are there. Well, I still don't do anything for a year, being in school model. Right? So I stayed and did that, and I got to be a clinical teacher for a year. So, which means, is actually a lot of what I do now, is teach senior veterinary students in the clinic. So hands-on, working with real live patients with real authentic diseases, right, or conditions that were having to be fixed. And I fell in love with teaching. That 1 year internship led to a 3 year residency, and I'm like, well, I still want to go back home. I was a little homesick, and that's the master plan. But they're like, just 3 years, 3 year residency. I'm like, well, I'm going for 3 years. So I did a 3 year residency, and during that time, I specialized in working, which mostly farming by farming clients. So I did cattle, pigs, well, food animals. And not a whole lot of horses, although they were kind of smattered in there a little bit. And then after that, it solidified my passion for teaching at the university. And I have been at OSU ever since. So that is basically my story, how I got into this. It is a super fun job. And in veterinary medicine, you are able to do a whole plethora of different things. From private practice, everybody did not with small and this. Do the run. You're living library, and you can all live vicariously through y'all. But I really fell in love with the teaching part, and every day is different. Some of you guys may know the story associated with this heifer, or these heifers, I should say, that are out there. So, because I was a little preoccupied doing some other things. Does anybody know the breed of these heifers? I think I heard it. What was it? Good. That's going Galloway. We're from cows. And so they've got the black on the front half is black, the back half is black. I guess that doesn't really make sense. The front, pick a fraction, less than half. Front is black, and then the back is black, and then they've got this belt in the middle. Good mom, for you from cows. And so that's these two heifers came to Iowa State. They probably grew up in a place like this. They didn't grow up, but probably this is what they're used to, right? They're just back 40 heifers, not used to the big city. If you ask them, they're like, Columbus is not for us. And the owner put them on a trailer and brought them, actually sent his son to take them to the Ohio State University for foot trims. That's what we do, right? Is we trim cattle. And one of the things about foot trimming cattle is that you get restraint, right? You can't just, usually they don't just pick up their feet for you like a horse would, or maybe a small animal would. Small animals got really wild. But we need restraint for these, and that's something we have here is good facilities and good restraint. We have a tilt table that we can put animals on, tilt them over, restrain the legs and trim their feet. So we actually do a lot of it. So the son of the owner of this cow brought these two animals to us for just a routine foot trim because the feet were overgrown. And so that was on the appointments. Well, anyway, the day that these animals came in, and I was on clinics, but I wasn't the primary doctor that was going to see these. And I was in my office. My office at the time was just outside the clinic. So it was like just walk out my door, through another door, and then I'm in the clinic. And I was close enough. I usually could hear things going on in the clinic. And typical day started out to be, heard the noise out. when these peppers come in. Person gate banging, maybe a little bit of yelling, but that's not atypical for a day in the clinic. Nothing too bad. And so I'm in my office doing some stuff, and then all of a sudden it got quiet, really quiet. I thought usually it's not that quiet. And after a couple minutes of quiet, I'm like, well, I'm probably getting more anything happening. Right? So I walk off, and nobody's around. There's a trailer backed up to the door. I look up and down the hallway, and if you're not familiar with our facility, there's a pretty long hallway. And there's no one that I can see except for way down at the far end, south end of the building. See one person, it's bright sunshine outside, and we're fairly dark inside. And there's the silhouette of someone, looks like some angelic figure standing in the door, right? Just like the sunshine. What's going on? So I'm like, I'm gonna go down and see what's happening. And they're just like staring out into space. And I get down there, it's our anesthesiologist, one of our anesthesiologists there. And I'm like, well, what's going on? And his words to me was, they're gone. And this is not, this is completely out of context to me. And I'm like, what's up? Who's gone? They're like, oh yeah, they're gone. What are you talking about? And he's like, go on. He's at the south end of the building, and you don't know where he's at the end of the building, like the end of our big long hallway, looking out towards Olentangy River, across the Olentangy River, towards like the stadium area, or actually kind of to the kind of the right of the stadium, sort of the tower area, right? And he's like, those peppers, they ran down Herrick Drive, they crossed Cannon, and they are gone. I'm like, oh no. And of course, everybody else that was working with them is somewhere en route trying to follow these heifers. And so I also joined the crowd. And this is the two heifers running around. These are the soccer fields over like where the band practices. This is the RCAC behind the area, or maybe this is like the natatorium, maybe RCAC's over here. But these heifers are running around. Not heifers are supposed to be in the same. So, not part of our containment plan anyway for the college. Some things that I learned. This is me in the blue scrubs here. This is one of my colleagues. And we're out on the field, pretty open. So if you're ever in this situation, something that I learned in class, think better in your look around and be responsible. One this day was, I learned many things, but one of the things was that soccer nets are not good for making a corral for wild peacock. Just throwing that out there. Because I'm like, well, let's see if we can get these and like sort of fence them in. And they pretty much went through that. So it's worth a shot. But anyway, so these are the two heifers running around. Eventually, we did manage to separate them. Probably also not the best thing in the world to have happened. This one ran back down the road, back Herrick Drive, and I'm like, oh, maybe it's going to go back to and turn right into the vet hospital. They're overshot it. Wednesday, well, it used to be visiting hall. They now work. I don't think it had anything to do with peppers running around, but went back there where we eventually ended up darting it with a dart gun and sedating enough for the whole run, but not until it got shot 8 times by the cop. It was underneath this tree over there, and eventually it was not. And so we were like, if you try to approach it, it was really scary. And so it was going to run. So we're like, well, let's figure out what we're going to do. And the police, the OSU police were there at this time. That was another thing that I learned this day. And I don't have a picture of that. There are some pictures out on the web of police cruisers trying to corral these. So another thing that I learned was why in the Old West, when they corral cattle, they use horses and not cows. They do less, the horses are way better at corralling cattle than cars. More maneuverable. So anyway, so if you ever run from the cops, hope that they're in a car and not mounted patrol. The same. I think your odds are better. But one of the heifers, after we separated him, was under the street, and there's like 2 or 3 cops that are there, and they're like, if she makes the move, we're taking her out. I'm like, all right, sounds good. And so at this point, started reading my mom. Well, actually, back on here and stop. It wasn't. But she did move, and they opened fire on her, and she just kind of jumped. And it was like, that was it. And then she stayed still. And then we ended up darting her and sedating her and putting a halter on her and dragging her into the trailer. She actually came back later. Not for the hook turn. Maybe we did do a hook turn too. But she developed an abscess over the area where she got shot. So we put her on the tilt table. This time we were successful. We didn't lose her. Put her on the tilt table. Lanced the abscess, recovered the bullets. And the section head at the time called the chief of police and said, hey, we've got these bullets. Do you want them? And he said, yes. So he came down. We had a whole specimen and we gave it to him. And I think there were 3 in there. And the guy said, the chief said, only 3? We're like, yeah. He's kind of like, oh, the police report said that there were 8 rounds that were fired. It's like, we only recovered 3. I don't know what to tell you. So who knows? But she was fine. This developed got pretty tough, apparently. And we developed full access. But every day said, this was one of the most memorable days in my career. But that is another great thing about stuff. Surgeon. And this is where I do a lot of my surgical procedures in this OR. Smile. We tend to have a very somewhat laid back atmosphere. We do a lot of procedures sometimes at one time, because we have a pretty busy service and we'll have one room to do it. And this day we're doing pig castrations, and we have 1, 2. There's 2 animals, 2 pigs on this table. 1, 2. There's 1 back here, 3, 4, and I think there's another one happening over here as well. So we love to see students on that whole. We love the and it's just on super fun combination, and it's amazing sometimes that I get to come to work and get paid to do it. So this is a recent case that we saw here, I'm going to say probably about a month ago. Unfortunately, he doesn't have a very cool name. His name is a number, it's 42759. 42759. I don't remember that, but it's on the slide. But he's a Longhorn. And he presented to us for lameness. And so he just had a painful gait. Anybody know? It's usually localized to where that's usually the problem. Yeah, good. In the hook. So the hook is that we say 90% of lameness is in the low part of the legs. usually in the hook. So we always like to do a good thorough exam, but we always evaluate the hook. So this is the tilt table that I talked about before. This is what we were going on until they escaped. And this requires us to usually get the animal kind of close to it, but hold on, pull the animal over to the table. This longhorn presented a little bit of a unique complication, and that we can't pull his head flat against the table like you typically try to do because it is longhorns. And so we have to kind of have his head tilted. But I thought it was funny because there was one student that was like, "How do you do this? Because you can't put him on the tilt table." And I'm like, "Oh yes, we will. You watch us." So we got him on there. But as soon as you gotta have to also to be really careful as you're pulling him over there. He's got this huge horn, and just a little movement in his head really has these sharp tipped long horns that it can be really dangerous. So we put him on the table, and does anybody see anything that looks that normal for these folks? They're not super easy to see. I zoomed in on them. So this is his so here we've got his right front, and here's his left front. If I zoom in on this, here's his right front and his left front there. And I will tell you, he was laying in his left front. So this is the foot that he was laying on. But there's a couple problems that maybe are noticeable, or that hopefully you notice. First of all, he's got a crack, vertical wall crack, in this foot, in this toe. So when you compare it to the other toe, is what it should look like. He's got a wall crack there. But that foot, he's actually not playing. So he seems to be pretty comfy on this foot. But this is the one he's laying on here. Notice anything is not door. Right here is a problem. What do you think about that? Oh, you can do this. Yes. Good job. So it's probably an old access. So horses, cattle, they get access to their hook. And so basically have access to the infection, usually associated with some pus, pressure, and it builds up, painful. And then at some point, usually they kind of open up, rupture out, and then they drink. And usually they get comfortable after that happens. But sometimes if that doesn't heal, that area where it opens up drains doesn't heal very well. Sometimes it'll turn into this kind of area like this. We call it and basically it's an area that should have pus growing over it. And there's sensitive tissue that's exposed. And so every stuff pokes them up into that, stuff pokes up the blocks. Hey, just dirt, whatever. Looks up at that area, and and so then, and so if you saw this, how do you think we should fix this? Yes.
Would you pack something like in it and then wrap it?
Yeah, really. So I'm going to pack something in. What's in the packing? Maybe some like antibiotic gauze or something like that to help with infection because it's infected at this point in time too. Sometimes, depending on what it looks like, we may just actually leave it open. So if any pus accumulates in there, it drains out. But those are, yeah, bandage would also be great. You know exactly what we're presented with at the time of, not we're actually evaluating this animal, but also maybe the management, what kind of environment is he going back to? Is he going back to a clean environment, going back to a dirty environment, going back to a dry, hard surface environment, or someplace that's flat, and we've got cleaner. And so, there's a bunch of different ways that you can manage this. But those are, I think that's an excellent suggestion, and certainly a way to manage this case. An advantage that we have over horses is that horses have one toe on each foot, right? Cattle, two. And this gives us an advantage when they have a lesion or a painful spot that's only on one toe, and usually it is. Usually they don't have something painful. But when they're painful in just one, what we can do is we can glue the wood on the other toe. Do I have a picture of that? Maybe. Because I think that's what we did, but I don't think. We can glue a wooden block on the other side. It doesn't have big plastic or rubber, and they come in different forms. The ones that we use in our hospital are wooden. But we glue a wooden block on the other toe, and that elevates the bad toe. So they're putting weight on the toe that hurts, and they're more comfortable, right? And so this is that's one way that we manage, and usually when they have something like that, that's what we'll do as well. So that's kind of the way that we manage it. I think we did end up leaving this open, and we managed it still for inmate, and then eventually ended up sending it home. We had a block on this, and then kind of flushed this area out, and put a little bit of topical antibiotics on it. What about this one? What do you think is happening there? It looks ugly, but I said it wasn't painful. The vertical wall cracks is actually a fairly common thing that we see. Any thoughts on how you might get cracked like this? Yes. Okay, yeah, potentially they could overgrow, and overgrown toes have a lot of leverage on them, and then they're more predisposed to cracking, which then can propagate up the wall and kind of split out. So that's one possibility. Any other thoughts? And I would think that maybe more commonly or more likely if maybe it was only cracked about way up, like from here up, and then everything from here up to the coronary band was normal. But being the whole way, I did question it, and I'm something else as well. Where, yes.
Would he probably compensated because his other foot hurt, putting most they carry their body weight in front, so probably putting most of his body weight forward.
Yeah, that's actually a really good thought. And certainly, when you see problems like this in another toe, or another leg, you have to wonder, are they overweight bearing on this because he's laying for so long in one toe? And we will see things like ligaments and tendons that get stretched out sometimes in the sound leg, the leg that they're good in, because they're using that leg so much, and they start breaking down in the good leg. And so that is a really, really good thought. I think the answer in him is still slightly different, but yes.
Could it be due to nutrient deficiency? Because in both groups there is something going on, whereas in the right one it might not necessarily be injured. However, if, for instance, it's nutrient deficient or not getting something through its diet, it can still show symptoms of that lack of nutrient or whatever it is. However, but since this other leg is actually injured, it could also be that something with the inside of causing the abscess because it's lacking that nutrient, or it's lacking something inside.
Yeah. And I think that's an excellent thought, and that is something to kind of think about, when and I think you're actually on the right track too. So you're thinking that maybe this crack is because there's growth abnormalities because of lacking some kind of nutrient, and so yeah, great. That's great thought, and I'm actually going to go down that road here in a second. So, and I'm glad you brought that up. Yes, so he has a lesion over here that is probably secondary to some traumatic event and like a puncture. But when they do have metabolic issues from, say, poor diet, sometimes getting too much grain can do it too, and cause a condition called laminitis, where they have poor quality hoof that grows out, they will often be more susceptible and predisposed to having some of these other problems. And so I think that is an excellent thought. Maybe poor nutrients actually predispose them to this problem, and it's causing poor growth over this. Along with that poor growth sort of idea, when you see a vertical wall crack, it goes all the way up to the coronary band, and that coronary band is basically analogous to the cuticle on your finger. Your fingernail grows from the cuticle, right? Grows out. That's where we call that nail bed. Same thing here. The growth happens at the coronary vein, and then it grows down. Okay. When I see a full vertical wall crack like that, wondering, things split from the bottom up. Yes, absolutely. But I entertain the possibility that maybe, just maybe, there was something that happened here at the coronary band and it damaged the coronary band. And all new hoof that has grown subsequently to that injury is growing with a defect in it. Because there's a hoof wall that's growing here, normal. And then there's hoof wall that's growing here on this side, normal. But right here, this hoof, that coronary band right there is not producing anything. So it's basically growing extracting. And that is another thing that we see. And it just so happens that this bull, back about a year or so ago, had a lesion right here. So this was that same bull, had a big defect right at the coronary band, or just a little bit above it. Had fairly normal hoof at that time, didn't have a vertical wall crack. But now he presents a year later. This is healed for the most part, from what you can see. Well, this is it kind of healing in. But now it's all healed up here, but his hoof is not growing yet. It is growing yet. And that is probably something that hits the wall. Luckily, it's not causing him pain. He gets around really well on it. It's just a cosmetic defect. But this tissue right up here around the coronary, what we call the coronary band, is really, really important tissue for growing good quality hoof. But he's a cool case. He was actually a pretty friendly bull. Thank goodness. Because these horns are formidable weapons. And that is how we attach them to the clip table. So normally, I should say an animal without horns, we put their head flat against the table and tie their halter, but he's just sitting there looking at us. His head's tied. And we actually tied his horns too, keep him swinging back and forth on the table as we work on him. So and also that he came in with a couple of girlfriends of his, also with some lameness or hoof issues that we put on the table. And in the process of getting one of them off, she pulled her head back and poked a hole in her door. So that's her door right there. And it's got a big hole in it. I got some Bondo. I had some Bondo at home for a project that I was working in. And I patched, so I was really proud of my patch. So you can see the little patch job. Someday, maybe I'll, but right now, I leave it so it'd be a conversation piece. And I can tell people about. It's like, this is where a longhorn put its hole in the door, or put a hole. So, every day is different. I've got a bunch of cases in this presentation I can talk about. So I'm going to talk about a case that was another memorable case for me. So, you guys know what a dissociation is? So dissociation is difficult birth, right? So we have dissociations that come all the time. And we do a lot of sexual procedures. We may do pull calves, we may do C-sections, but and there's episiotomies, you know what episiotomy is? You cut the fetus up inside so you can pull it out if it's dead. Sometimes the fetus is dead. So we had a cow, it was an Angus cow that came in for actually fairly long in labor with no progress. And when it came in, it was starting to become a little bit compromised. It had a high heart rate. It was obviously painful, kind of weak in the back legs. We always do a good assessment of the cow, good physical exam, and we try to do an assessment of the fetus as well. And we felt in there. And as we were looking at the calf, feeling the calf, the hooves basically fell off. The hair was falling out of the calf, which was pretty good indication that this calf is not a problem. And what you can appreciate with this is the smell. Someday we're gonna have a smell of it. And I can bring these lectures to you instead of just pictures and videos. I can bring you the smell, and that'll be a whole immersive experience. But as a you can't appreciate how bad this stunk. Anyway, so this was what we were presented, and we'd reach in there, feel around, and the calf was all puffy. They get puffy too. And that was what was making it difficult to pull out. So, how would you manage this case? What do you think about it? So you were the veterinarian. How would you approach June? And there's a bunch of different options. So, yeah, yes.
Give the mom antibiotic.
Okay, so yeah, start her on some antibiotics. I think that's a good idea. Yes.
Is there a way to take the patient out since
It uses.
Yeah.
Yeah, excellent. So that is what we call phlebotomy. And so basically, phlebotomy just means the surgical term for cutting, and phlebotomy is cutting the fetus. Okay, and so you can cut the fetus into pieces and take it out piece by piece. We started to go down that road, didn't do it this case. And I'll tell you the reason is because in order to do successful time, you need to have a lot of room to work inside of her. And when the fetuses get to this state of decomposition, as I mentioned before, they kind of get all swollen up. I'll use the term, and I'm going to use it incorrectly because I just need to get a point across. Realize that their bloat is not the right term, but they get all bloated, essentially. And they may be bloated too, but that specifically refers to a certain type of swelling, but they're just all swollen in there. So that's nothing, swollen, right? So these calves get really swollen, and usually there's no room to work in there. In order to do a phlebotomy, a successful phlebotomy, where you cut the calf to pieces, you need to be able to get things manipulated. So we did not do a phlebotomy, but excellent. And you wouldn't know that until you get your hand in there. Yeah, and hopefully we can avoid, So we actually take this out. And the best way, and we attempted vaginal delivery, so we tried to pull this calf, but again, it was just so swollen, it was not coming out. So we elected to take the cow to surgery and perform a C-section. And a little bit about C-sections. I love teaching about C-sections. It's one of my most fun surgeries. People ask me all the time, "What's your most fun surgery?" And I honestly don't know. And you can ask me, and I'm like, "Well, I don't know." C-sections are high on the list, and there's a lot of things that I like. But it's fun to talk about. Usually with C-sections, we do what we call a left flank approach. So typically in cow, we actually do them standing. Believe it or not, where the cow's not asleep, cow's standing. We numb up their side, specifically their left side, usually, and we pull the cap out. Does anybody know why we use the left side? Any cap? Yeah, well, actually, because the rumen is there on the left, and what it does is the rumen blocks all of the other intestines and keeps everything else from spilling out. The rumen is one big structure, and it's easier to deal with one big rumen than it is to deal with a ton of other intestines. So yeah, it has everything to do with the rumen. You can do it on the roots, but then you're fighting loops and loops of intestine, and there's way more intentional loops than you have veins, right? And at least there's one rumen, and most people have two hands and keep the rumen. One hand, one rumen, right? That rumen is way easier. So use the left one. Disadvantage though with a left flank C-section is that we don't get as good of exposure of the rumen because the animal's standing, and because we have to pull this rumen, I meant uterus. Look at that. Say that again. The disadvantage with a left flank C-section is we don't get as good of uterine exposure because the uterus is ventral, it's heavy, it's down on the ventral, the abdomen, and we've got. And so, in cases where it's really important to pull a lot of the uterus out, those cases we usually recommend to anesthetize the cow and do what we call a ventral midline C-section, where we actually lay the cow on her back and cut along the midline. So almost probably, if you know about section and you were envisioning a section in your mind, it's probably the approach you're normally thinking of. Because we can get better exposure to that. So we actually told the owner that that's the way that we recommended. However, the disadvantage of that, it's way more expensive, and the cow has to be anesthetized on the back, which actually adds some complications. So the owner said, no, we don't want to do that type of C-section. We want you to do the typical left flank C-section, standard. And so we did that. Well, we tried to do that. We put the cow in our chute. We call it transporter because it's mobile and we can transport them all around the hospital. So it says transporter. Is we put this cow in the chute, we numbed it, and we went in, the surgeons went in to scrub for the surgery. And while we were scrubbing, we were looking through the little window that we have our scrub room out into our OR, that room that you saw earlier, okay, Stafford, that stuff. And we looked down there, and what do you know? That cow that we were going to do a stage was laying down. And we have. So she laid down, this is her laying down in this little mobile chute that we call a transporter. And she laid down, and luckily she laid down on her right side, which was and we're going to do surgery on the left side, right? And we're like, well, let's just tie her down there and we'll do it laying down. So left flank, but to be laying. So we've got some ropes on her. Here's a rope on her back legs. I can't, my mouse doesn't work on my pant leg very well. So here's a rope on her back leg, tying her back leg down. We've got some ropes here tying her front leg down. She's laying down, we've opened her up. Guess what this structure right here is? That, my friends, is her rumen. And so her rumen's on the left side. And her yes. To get the uterus. And this is a case that we would really like to get a lot of the uterus exposed out in the incision before we cut into it, because everything that's in that uterus, that rotten dead calf and all the fluid that might be around there, really contaminated. We don't want to spill any of that down. And so I probably should have learned that earlier. Is that was the reason why we recommended an approach where we could get better uterine exposure. But we can't get from here, from this left flank, we just can't get that uterus. From the ventral midline, I think But from this, it's really, really hard because this rumen's in the way. So what we did was we actually did rumenotomy. So remember, otomy just means to cut. So rumenotomy is cutting the rumen, right? So you cut the rumen thing and evacuate your the so, but it's messy. It's a messy procedure. And there's a bunch of rumen contents here. We're putting it in a bucket. And so this is all rumen contents that we're spilling out. So this was phase 1 of the procedure, just to get room so we can get either, right? So we did that. And while we were doing this and evacuating all this rumen contents, the cow decided that it was time to stand up. And we're pretty versatile in food animal. We do surgery standing all the time. In fact, we wanted to do her standing. Actually, we wanted to do her sleeping. But then the owner didn't want to. So then he said, do it standing. And then we were going to do it standing. We wanted her standing. She lay down. We're like, okay, we can do it down because we're versatile in food animal. Do the up surgeries, we do down surgeries, we do surgeries awake, we do surgeries with them asleep. But with just about every procedure that I can think of, I won't say always, because you're not supposed to say always, but I can't think of a case where it differs from this yet. Whatever procedure you're doing, whatever position you're in when you start, usually it's a procedure or position that you want them to remain for the duration of surgery. Right? That's a little rule of thumb. And she decided midway that it was time for her to stand up. Well, unfortunately for her, remember those ropes that we had behind her legs in the front and back? Made it real challenging for her to stand up and keep her balance. So she stood up, and then she immediately fell back down. And this time, she fell down on her left side. And that was her side, if you remember, that we opened. Anybody want to take a guess as to what this structure is that popped out? Not her uterus yet. That is also her rumen, which we really didn't want to see. Like to see her uterus. Her uterus is still somewhere stuck inside her. The dead, rotten calf in there. But she now pushed her rumen out and she is dragging it all over the surgery room floor. The very exact room that I said I spend most of my days in, that we do all these procedures in, and all the pigs one day. Yep, that's the room. And she's now dragging her rumen on because it's a bad case. We ended up putting her down. But this is me just in standing in bewilderment. What just happened? What do I do? 3 days difference. Veterinary medicine. And this is one of the, this case is not one of the good things that happen, but this is one thing that makes this profession a lot of fun. A little side note. There's more to the story. I forgot about this part until a student sent me this picture and reminded me of the story. I was blocking this part out. This is me in the background, blocking everything else out. But it just so happens that we actually did have 2 procedures happening in this room at the same time. The camera angle doesn't show it, but we have a sheet anesthetized over on this side of the room. Under anesthesia. In fact, anesthesia is there. Passing gas. If they do. And that's such a joke. Gas. All right, anyway, so that was done. On gas anesthesia, sleep on fat. And it just so happened that a visiting student that from another university. And I don't think it was to do with anything that was happening in the room. I think she just had a medical condition or was sick. But she passed that. So she is on the floor over here with anesthesia. Passes well, so thank you. Thank you. And here's the, I think they were doing their like, this part of this from the scene, so but they were like giving her oxygen while she was passed out on the floor, and they called the squad, and so they come, the paramedics come, and they come through. This is our big sliding door, and so they park their ambulance out here outside. And they come in, this is about the scene where they come on scene, right? This is the environment. And they open this door and I didn't see no speculating, complete conjecture, right? Complete speculation. Just can imagine what's going through their mind when they open this door and they're expecting to see a passed out student on the floor. And in addition to the passed out student, this is what they see. Every day is different. And that is what makes this job really fun. Make everything learning experience. And you'll go far. So we did put that pal down, unfortunately. We called the owner and told them that this is not going well. And things were not going to end well. So here misery, but that is the scene. So if you want, that's the exact view. If you open that garage door with a paramedics in it, that is what they were able to see from their vantage point. It looks like with that, I am 2 minutes to being out of time. So I am more than happy to answer any questions that you might have about my experience with veterinary medicine, OSU, college, whatever I can answer for you. Otherwise, I really thank you guys for coming out at 7 o'clock on, is this a Wednesday? And appreciate your time.
If you have any questions, feel free to ask, let's stay after, you guys go to church that and give out the video. Thank you all for coming.
You're welcome.
Side of the rivers. I'm from the Ohio side.
Like St. Clairsville area?
Yeah. I like it there. So being the hills, like, oh
Yeah, I see it back home.
It's awesome.
Yes, sure.
thank you.
You're welcome. My pleasure.
Hi, I'm Sarah Bailey. Morning with emails.